Okay, can I have control? I need to take my earbuds out. Do I have control of the screen? Carolyn, can I share my screen? Okay, so I sent something on GroupMe. Let me go back and see if you guys got it. So okay, I only have 3 people logged in right now. Okay, more people are getting logged in. So if you go to www.kahoot, Kahoot, here, I'll even share it and you can see it. Okay, sorry guys, share my screen, my desktop. Okay. Okay, can y'all see my screen now? Give me a thumbs up. Okay, so this is where you need to go, just right here, www.kahootit. And then there's that game pin right there. So if you just want to do it on your phone, we're going to play a game. I'm going to throw up some insurance questions, and then you're going to have 30 seconds to answer it. The quicker you answer it, the more points you get if you're correct. And just some fun insurance facts that maybe you do or do not know, some average things, and just kind of do a little insurance education, that way. So I'll give you guys a couple minutes to do that. And while you're doing that, I haven't done a presentation in a while. So any of you guys that are new and really don't know much about me, my name's Christy. I do health insurance. I graduated from Texas A&M back in '97. I spent 4 years there getting my degree in education. So I started out my first 6 years as a teacher. I also got a master's degree in educational administration because I thought I wanted to be a principal. And then after my second son was born, and I always taught first grade. So that was my love, and that's what I taught. And then after my second son was born, I became kind of a stay-at-home mom and did that for several years, had some odd jobs. I worked on staff at my church for several years. I became a realtor for a while. And about 3 or 4 years ago, when, real estate's been booming and there were so many realtors out there, I just noticed that I was losing clients because their brother got their real estate license, or their cousin, or all these other people were getting their real estate license. And I was kind of losing some of my clients. And I thought, what can I do that's different? And you guys also know I was recently divorced, and really about 3 years ago, things started going downhill. So I was kind of hyper focused on what can I do to better support my family, my kids, take care of myself. So it was kind of a two-way thing, getting into the insurance, and I stumbled onto this. So I also, kind of going back, I do have 3 boys. My oldest is 19. He's a sophomore in college. I have a 17-year-old that is a junior at Lovejoy High School. And then my youngest is an 8th grader at Willow Springs. So my boys are my life, love them. I just love being a boy mom, and yeah, that's it. So is anybody not on yet? Will you just unmute yourself so I can give you another 30 seconds, or is anybody having trouble? Just let me know. Because I really can't see you guys. I can kind of only see my screen. Okay. All right. I hope this works. So, okay. I think what happens too, and I've done this once before. Okay. When I do start, the question's going to come up. It's going to start counting down, and on your phone or whatever you're using, you're going to you're going to have A, B, C, or D as your answer. And I hope I did everything kind of correctly. I told Catherine last night I was exhausted when I was doing this, and then as I went to bed, I started thinking of questions. So I was putting them on my phone, and I was trying to finish up this morning right before this. So if some of them are wrong, then sorry, but okay, let's start. Okay, insurance quiz. Okay, true, false. Deductible and max out of pocket are the same. A deductible and a max out of pocket are the same. And y'all can unmute if you want. I don't, we can have conversations.
So cool. I'm so excited. It's crazy. This is so cool. I'm so excited.
And I hope it's working. So
give me a minute to realize which one was thing, because I'm like, wait, blue, green, white.
Okay.
I'm correct.
So the answer is false. So your deductible and your max out of pocket are different. And I'm kind of just shooting myself in the foot because the next question you're all going to know now. Your deductible is the amount that you need to meet before your insurance actually will kick in and start paying benefits. So, you know, if you are having a surgery or something, you have that out of pocket. Maybe it's 2,000, 3,000, maybe it's 10,000. Your out of pocket max is how much that you hit before your insurance kicks in and starts paying 100%. So they actually are different. So you might have a, $5,000 deductible and a $10,000 max out of pocket. So once you hit that deductible at 5,000, then co-insurance kicks in. And again, that's another question. I didn't think about this. Then co-insurance kicks in and you're paying a percentage of your bills until you hit your max out of pocket. So they actually are different.
Okay, Christy, you always get your network rate though, right?
Yes, that's another question. So yes.
Okay, well, I won't ask.
That's okay. And as we do this, there'll kind of be a leaderboard on here too. So, all right, next question. And I may go over a little over 10 minutes, guys. I'm sorry. But we're having fun. So, okay. What is a deductible? I just told you guys. So I didn't think about the order of my questions. Y'all can see the answers, right? Okay, good. Yeah, because I can see you're answering.
But what did you just say?
Okay, exactly. All right. Oh my gosh, some of you even got it wrong. That's okay. What is your deductible? It is how much you pay before your benefits actually kick in. Okay, so again, it's that amount that you have to hit before your insurance starts kind of kicking in and paying the co-insurance. And my questions may be a little wonky too. So if I didn't word it very well, I take responsibility. All right. Ooh, wow.
Right.
Yeah. I was like, he and Lydia should do pretty good because they know some insurance terms. Okay.
Those are our ringers.
Yeah, I know. What is co-insurance? I kind of told you guys this a little bit too.
I have to go back and forth because the answers are on your screen at Zoom.
Yeah.
Right.
Oh, I'm sorry.
And that's why you have to go back to Zoom to see the answers and then you pick the code.
Oh, okay. Well, I'll start reading them too. I'll start reading them then. Okay. Okay, it is. It's the percent your insurance pays after you hit the deductible. So once you hit that deductible, you're going to have a co-insurance. Maybe it's 100%, which means you won't have anything else out of pocket. Maybe it's 80%. That means the insurance is going to pay 80% of your bills. You're going to pay 20% until you hit the max out of pocket. Okay. I'll read them. I'm sorry, guys. And I knew this might be a little hard, but I still hope it's kind of fun.
It's totally fun. Thank you.
Oh my gosh, we need to do this every week.
All right, next question. What group of people usually need health insurance? Red, healthy people. Yellow, people over 40. Blue, sick people. Green, everyone.
Need insurance. Everyone.
What group of people usually need health insurance? Red is healthy people. Yellow is people over 40. Blue is sick people. Green is everyone. If any of you get this wrong, I'm going to smack you.
That's a trick question. Need.
Oh my gosh, somebody still got it wrong. Sick people. Yes.
That's a trick question.
It is not a trick question. Everyone needs health insurance. You don't get insurance after something happens. And you know, this is a life insurance. You can't get life insurance after you die. You can't get car insurance to cover a wreck that you already had. Everyone needs health insurance because you never know what's going to happen.
But you should get it when you're healthy. Right?
Yeah. All right. Cat
Right.
mom.
You want to make it catastrophic.
True, false. There is still a mandate that you have to have insurance with minimal essential coverage. So red is true, blue is false. Red is true, blue is false. There is still a mandate that you have to have insurance with minimal essential coverage. The other two are just kind of goofy answers, but yeah, red is true, blue is false. Maybe I should have done less than 30 seconds.
No, it's good. We can think about it.
Okay.
We're coming up on 10 minutes, but we can go 5 minutes
Okay.
more, so we're good.
I got it wrong.
The answer is true. So yes, there still is a mandate that you have to have insurance with minimal essential coverage. Now, what is different is when Trump, I think 2019, they got rid of the penalty. So you don't have to pay that tax penalty on your taxes anymore, but the mandate is actually still there. And if y'all have been listening with the Obamacare is actually up in the Supreme Court right now. That's what they're debating, to repeal it. And the news has said overwhelmingly, they're probably not going to repeal it except for the mandate. So that is the one thing they are considering repealing is the mandate. And basically all that means is minimal essential coverage is a plan that's going to not deny anybody health insurance and also covers drug and alcohol rehab, mental health, abortion, and maternity. So what I do is I do kind of off-market or private plans that don't follow those ACA rules. They don't have minimal essential coverage, but a lot of people don't need those anymore. And you can actually kind of get better coverage if you don't follow those ACA rules. So mandate is still there. The tax penalty is gone. So that one was kind of tricky, but
That one was a tricky one. For me.
I know, but I'm just trying to give you an education. So.
Yeah, go for it. It's fun. I love this.
What makes a plan short term? What makes it short term? Red, it only lasts 6 months.
Oh, it's definitely short people.
Yep, short people can get it. Blue, it only covers catastrophic. And green, when the term ends, the company doesn't have to renew your plan.
Yeah, that's kind of confusing with number red.
I know. So actually the answer is green. So you can actually have a short-term plan up to 3 years. You can have it for a month, 2 months, 3 months, 6 months. You can actually have it. What it means term, when the term ends, so whether you have a 6-month term, a 1-year term, a 3-year term, at the end of that term, if your health has changed and maybe you now have cancer, you've had a heart attack, you have diabetes, the insurance company does not have to renew your plan. So they can say, you know what, Catherine, you're not healthy anymore. We don't want to cover you. We're not going to renew your coverage. And a lot of people don't realize that they have short-term plans. United Healthcare has one called Golden Rule, which is not bad. But again, they don't have to renew you. They can drop you for any reason whatsoever. So if you think you have a short-term plan and you're still healthy, I have options that are long-term that you can never get kicked off of. So anyway.
Okay.
I'm going to be kicked off for not having the right answer.
That's okay. It's just fun. All right, we got a couple, and if we need to stop early, let me know. Okay, what does ACA stand for? What does ACA stand for? Red, Affordable Care Action. Yellow, affordable, always cost affordable. Blue, Affordable Care Act. Or green, always consuming apples.
Oh, I pressed in the wrong answer too fast.
Because an apple a day keeps.
There's no going back.
It's green. I think it's green.
Yeah.
So it is actually the Affordable Care Act. So ACA stands for the Affordable Care Act.
I got it right here, but it didn't show there.
I'm sorry, guys. Okay.
No, oh.
All right. When is open enrollment for the ACA? Red all year, yellow November and December, blue January and February, or green October through November. When is open enrollment for the ACA?
And Christy, after this, we probably have time for 2 more and then
Okay.
we'll wrap
Yeah,
it
I
up.
think I'm actually almost done.
Okay,
I think there's only a couple questions left.
you have 5 more.
Okay.
This is 8.
Oh, I do.
Oh, I got it.
Okay, they're right. It is November to December. We are right smack in the middle of open enrollment. It started November 1st and it goes to December 15th. Sometimes they might extend it. I mean, with COVID, maybe they might extend it, but we're actually not going to know till about December 15th. So, okay. I'll try to be quick and kind of skip the scoreboard so we go a little faster. What is not another name for Affordable Care Act? So, Affordable Care Act, what do we call it? Do we call it Obamacare, ACA, Marketplace, or private insurance? Which one do we not call it? Not another name for the ACA or Affordable Care Act. I just gave you an answer. Not another name. Obamacare, ACA, Marketplace, or private insurance.
Private insurance. Private insurance. Yes.
So yes, it is private insurance. So when you hear people say Obamacare, ACA Marketplace, it is all the same thing. Private insurance is actually what I do. Again, we're not ACA plans, and that's done on purpose. We medically underwrite our clients so we can get them better coverage, you know, if they're healthy. Okay. All right. I think some of my last questions were the best. Okay. What option is not a network? So when you're looking at plans, what is not considered a network? An HSA, yellow is EPO, green is HMO, and blue is HMO and green is PPO. So if you can see it, this is not considered a network. Red HSA, yellow EPO, blue HMO, and green PPO. Okay, right, HSA. HSA is a health savings account, which is money you can put in to take out that's non-tax deductible. That is actually not considered a network. The other ones are networks. You have an EPO, exclusive provider organization, which is the smallest network you can have. You have an HMO, health maintenance organization, which is a little bit bigger, but you usually are assigned a doctor. And then you have a PPO, which is the biggest network you have. And with PPOs, you actually can have in and out of network benefits. Okay, do we have time for one more, Catherine?
One more, and then we're good to go.
Okay. I've got 3, 11, 12, 13. Okay. What age is someone eligible for Medicare? Red 55, or yellow is 60, blue is 65, and green is 70. So what age is someone eligible for Medicare?
I keep trying to click the answer on the screen in front of me.
Yeah, me too.
Sorry, guys. I know it's a
Oh,
little
I
hard.
gotta do my phone.
Don't be sorry. It's so fun.
I love this app, by the way, Christy. Thanks for introducing it to us.
This would be a fun family game for the holidays.
Okay, so you're right. It's 65. Now, if you have a job and you have employer insurance, you don't have to get on Medicare at 65. You can stay on your employer insurance a little bit longer until you quit your job, you know. But most people are eligible at age 65. I cannot write anybody over 65. I have to send them to someone that has Medicare. Okay.
Oh.
So if that is it, if we stop, Carolyn won. So anyway, you can just kind of see your answers here. Cat Mom, Cat, Aggie Dad, Anna. Anyway, so yeah, I hope you guys enjoy that. I'm just anyway, I'm gonna go through these really quickly if I can. Okay, I actually like this question. If we could do one more. This is a really good question. And then
Oh,
I'll
I
stop,
just backed
promise.
out.
Oh, that's okay. I'll just tell you, it says who regulates insurance. So if you're not on that, and my options were the insurance company, the state, the country, or the county. And that's okay if you're not on. We'll still say that Carolyn wins. But yeah, so don't worry about it. I'll just see it anyway. It's counting down. And this is actually a really interesting question. And it is actually one person got it right. It is the state. So each state is going to regulate their insurance. If you go to different states, the Obamacare plans are going to be different. Maybe the age that the child ages out is going to be different. Maybe things that they do or do not cover is going to be different. So each state actually controls kind of different options on their insurance. So, okay.
Okay, Christy, I'm sure you can hang out after the meeting and answer any questions that the team has.
I can for a little bit. I have I'm actually doing a Kahoot for my team too. We're doing something completely different. So I may have to, I'll hang out as long as I can, but we have our team meeting that they started.
Perfect.
Yeah.
Thank you. So we are going to do a lightning round of thank yous and referrals. We have 12 minutes.
Sharing. Sorry.
That's okay.
Screen. Top of your screen, there should be
okay.
a stop share.
Okay.
There you go. It is okay.